Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is today's COVID-19 report for British Columbia. I want to acknowledge that we're honored to be on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. I wanted to note that this evening at 7:15, Vancouver Coastal Health will be having its virtual town hall. That will be CEO Mary Ackenhusen and Chief Medical Officer Dr. Patricia Daly fielding your questions, and it will be hosted by MLAs George Chow and Teresa Watt. We thank them and their guests for providing what should be a very helpful session. You can reach or watch the virtual town hall on the Government of BC's Facebook page or the Province of BC's YouTube channel. And if you don't have a chance to submit your questions ahead of time, you can ask your questions during the virtual town hall on the BC Government Facebook page. And so we encourage everyone to have a look tonight. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. This is our COVID-19 update for May 25th, and it includes the two reporting periods since we had our last media update. So we had 5 new cases who tested positive for COVID-19 between Saturday and Sunday, an additional 7 cases between Sunday and today. That brings our total of new cases of people who have tested positive in BC to 12, and our overall total to 2,530 people in BC. That includes 894 people in the Vancouver Coastal Health Region, 1,253 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 194 people in the Interior Health Region, and 62 people in Northern Health. We continue to have 16 active outbreaks in our healthcare system, 14 of those in long-term care and assisted living and 2 in acute care units. There are no new outbreaks, and we do have, unfortunately, an additional 3 cases, bringing our total to 333 residents who have been affected in the healthcare system and 209 staff. We have no new community outbreaks. We're continuing to monitor and support at the facilities where we've had outbreaks in the past, including the most recent ones in a correctional facility at Mountain and Matsqui. It was a person who was between both of those facilities, and the outbreak investigation continues at both, as well as the more recent one related to the frozen fruit packing. And just to be clear, there has not been any reported cases of food or food packaging being associated with the transmission of COVID-19. And I have been receiving some questions about whether it's safe to eat the products of some of the facilities where we have had outbreaks, and the answer is yes, the food supply is safe and continues to be safe, including products from facilities where there have been outbreaks. In terms of our cases, we now have 267 active cases around the province, and of those, 37 people are in hospital right now, including 7 in critical care or ICU. Over the past 2 days, we have had an additional 4 people who have died from COVID-19 in British Columbia, all of them residents of long-term care, and that brings our total to 161 people who have passed away from COVID-19. And of course, our condolences go to their families and to their care teams and the challenges that this virus has caused and the grief that it causes for all of our communities when our seniors and elders die from COVID-19. There are 2,102 people who have now fully recovered after testing positive. So a couple of things today. We have 1 week left in our survey, our province-wide survey, to gather your feedback called Your Story, Our Future. We have over 313,000 people who have answered so far, but we are still encouraging anyone who has not completed the survey that you can do it both online on the BC CDC website or by phone in many different languages. And we want to be sure to hear your story of your experiences during this pandemic so we can best understand where the needs are and the things that we have to do moving forward. And we are moving forward. And as we do that, we are starting the second week of our pandemic restart, and we are monitoring our pandemic in BC very closely, as well as that of the experiences across Canada and other parts of the world, so that we can continue to chart our course forward. We have made significant progress, as you can see, and I'm encouraged that our new cases, our new numbers continue to track low, although we still have ongoing challenges with our outbreaks, and we know that in those places where businesses have been up and running, we have had occasions where we've had introductions that have led to clusters and outbreaks as well. As we see many places now that are opening up, we may see a resurgence of new cases, and none of us want that. We need to keep our curve flat, and as flat as we possibly can, as we look to ease more restrictions later this summer. And we will be watching especially closely over the coming week. As we know, this is the first week of the incubation period, the 2-week incubation period. And I look forward to monitoring and providing some more of the data for you all next week that will help us understand where we've been as we've started this process. But the key to our success in this phase and in the future is all of us working together. We need to be coordinated, and we need to continue to take those measures that we have been taking to keep our families, ourselves, and our communities safe. Today is also the start of BC Paramedic Services Week, and I just want to recognize that these emergency first responders are an integral part of our health response and our communities. They are professionals that are with us from the moment we call 911 to when we get to hospital, and is part of our system of experts helping to protect us across our province. And as well, they work in our communities. We have had for the last, I think it's going on 5 years now, a community paramedicine program that has used the expertise of paramedics in communities across BC to prevent people from needing emergency services in the first place, and to engage with people in the community at home to help with their health assessments and to keep them safe. And I want to say thank you to my paramedic friends and the paramedic family across this province for all of the work that you do. In step with these efforts, of course, we continue to have our public health teams test, trace, and track the spread of COVID-19 so that we can put out any hotspots that arise as we're moving into this next phase of our pandemic here in BC. As you know, our frontline healthcare workers are providing the care we may need, and our scheduled surgeries have started up again. And other health professionals are also starting up back in our communities. And this is an important health response, and we will be ensuring that we are continuing to monitor and support our health professionals across the province. As individuals, we must also continue to keep doing our part. Our efforts are working, and we are making progress. People are doing the right things. We're following our rules for the safe social interactions, and we're taking necessary precautions. We are being thoughtful and careful as we're moving into this phase. And I really do take that as a positive sign that British Columbians have heeded our advice and that we are doing what we need to do to protect us all. I understand as well today there is a very high demand for our many provincial campgrounds. Also something I think is positive, and a reflection that we are taking to heart that need to stay close to home this summer and to experience all the many beautiful places in our province. What is clear for all of us is that our success so far and our ability to ease restrictions relies on our shared commitment and effort, and we need that to continue. As we have said, that means working together, recognizing that we all have our own challenges and experiences, and continue to be tolerant and generous and respectful with each other. So let's keep going. Let's keep doing what we need to do in a thoughtful and careful way, and keep being kind and being calm and staying safe.
Thank you very much, Dr. Henry. I wanted to join Dr. Henry on behalf of the whole province in expressing condolences to the families of the 4 people who have passed away since Saturday's briefing from COVID-19. All of them were in long-term care, all of them at a long-term care facility at Langley Lodge, and we think of them, we think of their caregivers, we think of their families today, and we wanted to express our condolences and our understanding of their sorrow. This is a very, very difficult time for everyone who's struggling with COVID-19 in BC, and we can't ever forget the cost. It's a good reminder of why we have taken such strong measures in BC. I just want to put it in context. Between 4,000 and 5,000 people have passed away in care homes in Ontario and Quebec from COVID-19. And that's not to make a comparison between the provinces. They've struggled with their COVID-19 pandemic. But what it tells us, I think, fundamentally, is the vulnerability to COVID-19 of people living in long-term care and why we need to take the measures from the single site measure to our very strong measures, which are very difficult for people in terms of not having people visit in long-term care and in acute care, why those measures have to continue. It's a very, very difficult situation. The living of it is very difficult for families. And I want everybody to know, everyone in BC to know, that when they express concern to me, as people do on email frequently, that I absolutely hear and understand that it affects my family just as it affects many, many other families. And we are thinking of all of you and wanting to be supportive of all of you. But for the moment, it is not possible to change those policies around visiting, although they're constantly being reviewed, because we know of the consequences for families of people not being allowed to visit. But we also understand the safety that's required and the needs to be safe in our long-term care homes. And if anything else, the results that we see, in spite of a flattening of the curve in long-term care, an indication of that. I wanted to note that we have 37 people hospitalized. That's down 2 from Saturday's briefing. That's 19 in Fraser Health, 1 in Interior Health, 1 in Island Health, and 1 in Northern Health, and 15 in Vancouver Coastal Health, for a total of 37, 7 in critical care. That's also down 1. I wanted to note that in terms of emergency room visits, something we've briefed on, provided a briefing on consistently over the last number of weeks, over the 3 days since I talked about it on Thursday. Thursday, Friday, Saturday, it was 5,101 visits. On Thursday, 4,844 visits. On Friday, 5,102 visits. On Saturday, which are fairly consistent numbers. To put it in context again, it was just over 6,500 on May the 9th, and it dropped just under 3,000 at the beginning of April, emergency room visits. And so this reflects a new normal of emergency room visits, which is significantly up from the bottom at the beginning of April, and indicates people using, as they should, emergency room services when they need help. And we can encourage people who need to be in an emergency room to continue to go. I wanted to acknowledge that we had 2 town halls last week, one in Island Health that was chaired by or emceed by Ronna Ray Leonard, the MLA for the Comox Valley, and Norm Letnick, the opposition health critic. It involved CEO Kathy McNeil and Richard Stanwyck. It had 13,000 viewers. Fraser Health had its second town hall on virtual town hall on Friday, May 22nd, with 11,000 viewers. And we want to express our appreciation to Dr. Victoria Lee, Dr. Martin Lavoie, respectively the CEO and the Chief Medical Officer of Fraser Health, and MLA hosts Bob Deeth and Joan Isaacs for an equally impressive show. And I wanted to thank all the people who submitted helpful questions and encourage everyone to join Vancouver Coastal Health's team tonight. In closing, I just wanted to say thank you to all people in BC. This is, by all accounts, it's certainly what I experienced in my neighborhood. Our first weekend of renewed social and economic context went well. Thank you to everyone who's helping get our BC Restart Plan off to a strong start by starting on the best kind of footing, one where we stay 6 feet apart. As we enter week 2 of phase 2, it's up to each one of us on how we proceed. For some, our comfort zone includes getting a haircut. safely expanding our contacts, or visiting a local retailers. For others, it's holding off until we feel the time is right for us. For all of us, staying safe in this welcome phase 2 depends on each of us ensuring that our comfort zone includes physical distancing. I'll report on surgical renewal progress later this week, but right now it's weekends like the one we just had, every day really, where we continue to use the skills that Dr. Henry has taught us that gives surgical renewal its best chance to succeed. Every day we stay 100% committed to preventing a resurgence. Every day we remember that physical distancing saves lives and our actions spread that message and not the virus. Then we've done our job to help those in operating rooms do theirs. We all have a vitally important role. Our success in sticking with it is what has brought us to this encouraging point in our COVID-19 effort. So again, to everyone in BC, thank you. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle de 23 et 24 mai et celle du 24 mai jusqu'au 25 mai en mi-journée. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19 dans la région de santé de Fraser, pour un total de 161 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Pour la première période de référence qui s'étend jusqu'au 24 mai, nous avons eu 5 nouveaux cas. Au cours des dernières 24 heures, 7 nouveaux cas se sont ajoutés. Cela représente 12 nouveaux cas depuis notre dernière mise à jour samedi, pour un total de 2530 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 37 personnes sont actuellement hospitalisées, dont 7 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you. As a reminder to everybody on the phone line, please press *1 to enter the queue. You are limited to 1 question. Please also take your phones off mute. You will not be audible until I call your name. First question is from Jennifer Saltman, Vancouver Sun.
You amended your order around gatherings last week, and I'm just looking to clarify that for drive-ins, it's 50 vehicles and not 50 people, and that it applies to both event and permanent drive-ins like Twilight and Alden Grove. And could you explain the rationale behind the 50 vehicle limit?
Sure. Yes, and it does apply to 50 vehicles. And this was, this is this phase where we are gradually moving into opening things up, and we need to be very cognizant about having small numbers of people. And that means, yes, we have a less risky environment when people are in cars. So yes, you can have more than one person in a car, but that becomes a very challenging situation when you have large numbers of vehicles, and to be able to monitor and ensure that you don't have those multiple numbers of connections becomes much more challenging. So for this phase, it does apply to 50 vehicles. It applies to places like drive-ins. There was a number of events we know that were being planned. Some of them were going to be quite large. And this is what we need to do right now. This is not forever, but it is for this phase. We need to be consistent, and we've been using the 50 as our number, and as I've said before, there's no real science behind it, but it is a rational approach that we want to be consistent across all of our venues when we're talking about gatherings and events.
Next question is from Tanya Fletcher, CBC.
Hi, Dr. Henry. My question is also about that, just following up on your public health order. Many organizers of outdoor festivals, those drive-in events, were surprised. They're asking for flexibility so they can find a safe way to operate. To break even, they say they would need to scale up to a few hundred vehicles, and they believe they could do so safely. So would you consider making an exemption or tailoring the order so they could go ahead in a safe way in time for summer at all? You mentioned not this phase, but in time to catch any of the summer season, would you expect?
So right now it's 50, and that is something that we've been in discussions with the sector about, and there are ways that people can look at making profit, and that's part of it. That's a challenge for many businesses. We know that. So there's different models that people can look at within that restriction, and it depends on how things go over the coming weeks to months. And maybe we will be at a point come the summer we'll be able to expand that, but I can't predict that at this moment. For the next little while, we're sticking with what we know about mass gatherings and about the risks that they present. So large gatherings, it's much more challenging to be able to ensure that we're not having large numbers of people that can get together. We know that people don't stay in their cars all the time when you're at these events, and the more people we have, the more chances we are that this virus can spread to a lot of other people. It also makes our job in finding people much more challenging when there's exposures that happen over large numbers of people. So that's the rationale for now. We will be continually revising and reviewing how these things happen over the coming weeks, and it certainly is possible that we could look at safe ways of having larger numbers, but I think we need to be more cautious. We do not want to go back to where we were. We do not want to put to waste all of the efforts that we have done as a community across this province. And I think this is one of the things that we need to take a deep breath and realize, these aren't things to be got around. It's about trying to have a reasonable approach that we can sustain, that we're not going to put people at risk over the coming weeks and months.
Richard Zussman, Global News.
Thank you for taking my question. Dr. Henry, have there been discussions or conversations yet about, come September, what plans are in place for severely immune-compromised kids when it comes to their education, given we're expecting a potential second wave in the fall? Will these kids have to be homeschooled? Will the ministry continue to provide them online education if the system moves back to regularity in the fall?
Yeah, so all of those details, of course, are being worked out primarily by the Ministry of Education, with us providing support. So I don't have details on that, but those are certainly things we're considering. And we're looking at how things go, how we're able to manage in June, come next week, with smaller numbers. And one thing that will not change is the importance of all of those measures that we have in place to reduce the possibility of transmission between people. So I expect there'll be some degree of a hybrid system come the fall as well.
Marcella Bernardo, News 1130.
Hi, Dr. Henry. I have a couple questions. Just for a quick clarification, is the Twilight Drive-In Theater, which allows up to 200 cars now, does that fall under these restrictions that you're talking about when it comes to event planning? And also, what about people who are trying to meet with loved ones at Peace Arch border crossing? We understand that people are now crossing just to hug each other, and I'm wondering whether or not you're concerned about that, or what measures are being taken to try to help reunite families living on both sides of the border.
Yeah, so all drive-ins are covered by this, yes. I'm not aware of the specifics of any one business in the province. In terms of the border, I know there's challenges. It is not, the border is not under my control. It is the Canadian Border Service Agency and the Quarantine Service that has put the restrictions on who can come across the border. But I have said, and we have advocated with our federal partners, to have some ability for family reunification, or reunification of people who are across the borders and have relationships on either side. So yeah, you want to
As you know, Marcella, the current rules have now been extended around visitors at the border till June the 21st. And as I've said before, my expectation is that will continue. And while there may be some discussion about some of the issues you raised, the fundamental question remains, which is the need to ensure that we don't have transmission in BC. And that's why I don't see the border opening for visitors anytime soon. We may be able to have some workarounds for that, but I think the challenge with that, as we see in every single case, is that it's very difficult to apply those narrowly enough to make them work. So those are kinds of issues we're working on, but I also continue to expect that we won't have visitors from the United States or from Canada to the United States in the next period. And I think that's the right thing. It's something we've consistently advocated for. I want to also note, and it's always challenging, that I think Dr. Henry has said consistently, talked about a limit of 50 people in mass gatherings, and often I get questions as well. We get questions on both different media appearances and others and online about people who may are seeking ways around that, understandably, because of the challenge it presents for their business or for their nonprofit organization, for their religious organization. But it's not just the purpose of the 50 limit on gathering has always been to limit transmission. And in addition to that, if people gather, we have to take into account the need for physical distancing. It's not physical distancing as an alternative to the 50 limit on gatherings. It's physical distancing and the limit of 50 on gatherings.
Next question is from Jen St. Dennis, CTV.
Hi, Dr. Henry. My question is also about drive-ins. Sorry. Is there anything that the organizers of these events could say or do to make you change your mind and allow more cars?
Well, you just heard the purpose of this. And, we need to think as well about the people who work in the facility and their exposures to large numbers of people. So, drive-ins is just one part of it. We've been talking to religious leaders. We've been talking to others. And the limit right now is 50. For a whole variety of reasons, so that we don't give this virus a chance to spread between large numbers of people. We're not exposing individuals to larger numbers of people, and we're able to find people in a quick way should we have cases arise. So that's where we are right now. And that's what we'll need to do for the coming period of time. And if and when we get to the point, we will be absolutely looking at this again. We've been talking about the 2 incubation periods, and then looking at if our numbers stay down, if we're not having transmission, then we will revisit it, absolutely. But that's where we are right now.
Next question is from Kat Slepian, Black Press.
Hi, Dr. Henry. You spoke about the fears of seeing a resurgence in cases. What sort of resurgence would you have to see before you add restrictions back on?
Yeah, so my intent is not to add restrictions back on. That's why we're I'm so focused on making sure that we have the precautions in place that we need now, because these are the things that are going to allow us to continue with the surgeries, to make sure that we have enough room in our hospitals should we start seeing more people. So there's a whole variety of indicators we're looking at, but there's no set number. So it depends on how many cases we get in our communities that are unlinked, and how long it takes us to find people, how many contacts people are having, whether we're having outbreaks in some of the new employment places that have opened up recently. So it's taking into account a lot of these measures. It's about having the prevalence increasing in our community, particularly having community transmission that is not linked to a known case or an outbreak. Right now we have very few of those, and so we want to keep it that way. And that, because it's a measure of spread that is going undetected. And part of it means that we have to have the ability to do rapid contact tracing. Right now we have that too. We are getting to every case within 24 hours. We're finding their contacts within a very short period of time. I'll be continuing to monitor that. And it's having the testing capacity. And right now we have that as well across the province, to be able to rapidly test anybody who we are concerned about, who has a risk factor, who's part of a cluster investigation, even if it's a large one. So those are things that we'll be continuing to watch over time.
Next question is from Wyra Witten, the Tyee.
Hi, good afternoon, Dr. Henry. My question is about the closures in sexual health services in the Vancouver area. I know earlier this month, you were advising how people could move forward on it with dating and new relationships. But, we're not seeing any routine or non-urgent testing available in the city. I'm wondering when you think it might be advisable for sexual health clinics to reopen to routine non-urgent testing, and any advice you have for people dating without that resource available to them.
I'm sorry, I didn't catch what you said. Any special? I'm sorry, I couldn't hear what you said was being closed.
Oh, sexual health clinics.
Health clinics. Okay. No, we do expect that the sexual health clinics will increase and have be more accessible, as many of the community healthcare services are increasing as well. So as you mentioned, that is a really important part. I will also mention that people can go to Get Checked Online and go through. That's a really great resource for sexual health testing. And of course, it goes to the other important thing that we have had increases in gonorrhea and chlamydia, and we are still in the midst of an outbreak of syphilis in this province. So making sure that safe sex is a part of any of your new relationships right now. So testing is a part of it. The sexual health clinics will be opening up, and Get Checked Online is available for you, and the importance of using condoms for protection is still a very important thing.
Cindy Harnett, Times Colonist.
Thanks for taking my question. Minister Dix, I appreciate the seriousness of the outbreak in long-term care, but what would have to happen to have visitation to care home and hospitals occur this summer? Do you imagine it will happen this summer? Dr. Henry seemed to indicate that visitation may be considered depending on the course of the virus and other factors this summer.
I'll start by saying, and I have said that, and I'll continue to say that, and I know we know the incredibly importance of having family to support and close friends to support people who are in long-term care, and that they provide such an important service within our care homes. We know, however, that right now it's still quite dangerous, and everybody has their one, but that whole community can be at risk, and many of us who are visiting in care homes may be at risk ourselves. So there's that whole dynamic that happens in the care homes, and we know they're very fragile and at risk right now. But our health authorities are looking at how can we make that happen in a way that's safe for everybody in the coming times when we get to that point.
Well, I think in short, Cindy, we're going to follow the medical evidence, the advice of our health team, Dr. Henry and others, to come to that solution. But I would say that I don't see it in the immediate. I'll just give you an example. We've had one care home that's in a very small period of time gone from no people passed away to 20. And that's the vulnerability. We've had outbreaks, not many, but outbreaks in acute care. And the key right now is to ensure that we continue to flatten the curve. And so part of, I guess, what I would say in all these cases, part of how we're going to succeed in renewing surgeries in the province, and we're doing so now, part of how we're going to succeed in bringing back the important visits that are an essential part of life in long-term care is that we continue to do the things, all of us, that are required. COVID-19 is a pernicious enemy in this, and the people who it targets the most effectively are people who are living in long-term care and in acute care. This has been demonstrated not just in Canada, but everywhere around the world. And so nobody wants to stop visits to long-term care 1 second longer than it's required. But right now it's still required, and we still have to do it. And it is heartbreaking. It is absolutely heartbreaking, but it is also absolutely necessary.
Next question is from Jane Side, North Shore News.
Hello, Dr. Henry. My question today is about kids who may be returning to school next week in a limited fashion. I am wondering, firstly, whether we have had any cases in British Columbia of this post-COVID multi-syndrome, Kawasaki-like syndrome that they've been talking about in New York. And also, I'm just wondering if you can give us a bit of an update on the current science about transmission from kid to kid, from kid to adult, because I think you've said in the past that the transmission chances are very low, and I'm just wondering if that's still the case.
Yeah, so really important questions, and we talked a little bit about whatever you call it, because it has a number of different names, whether you're in Europe, the UK, or the United States. But the Kawasaki-like syndrome that we're seeing in children around the world, so there has been a couple hundred cases identified in Europe and the UK and in the United States, in a number, 19 different states right now. And it is a post-viral syndrome, it appears. Some of them are associated with COVID-19. We never knew exactly what the cause was of Kawasaki syndrome, but it has arisen mostly in younger children after infections, some viral infections, some bacterial infections. So it is conceivable, it's certainly plausible that COVID-19 could be leading to this in some children. We have made it a reportable condition here in BC, which means that we can go back and look at children I've asked to go back and look to January to see if we have we would expect some cases of Kawasaki syndrome because we tend to see it during influenza season, but whether any of them are related to COVID. And I know there has been a look particularly at Children's Hospital with some of my pediatric colleagues have been looking into this, and there are at least half a dozen that they're investigating. None has yet been confirmed to be related to COVID-19. So we don't have any known confirmed cases related to COVID-19 yet in the province, but that investigation is still ongoing, and I will keep you up to date as we learn more about this syndrome. I will say it is quite rare still, and there has been 3 that I'm aware of deaths in the United States of children, so it is something that we are watching very, very carefully. And the data still is coming in around children being affected by COVID-19, and it is clear around the world that they are less likely to be infected with COVID-19 than adults. And in BC, that bears out as well, where children under 10 in particular are less than 1% of the cases that we've seen here in the province. I think we're up to 27 children under the age of 10. And they are around the world as well. We're seeing much fewer cases of children needing to be hospitalized or have intensive care support. And we have had no young people under the age of 19 who have needed to be in ICU, and we've had no deaths in BC. We've had, I think we're up to 78 or 79 overall of young people under the age of 19, and we've had 3 hospitalizations. So that is the good news for us. We've seen some data that's come out of Australia, New Zealand, and others that show that it is much more likely for children to be infected from an adult than vice versa. And it may have something to do, there's a nice study that came out on the weekend that looked at the ACE2 receptors. So we know that COVID binds to the angiotensin converting enzyme receptors that are in the back of one's nose and throat and in your lungs and in your gut, and that children seem to have fewer of those until we get into our older teens and 20s. So that may have something to do why it seems to be less likely that children will get one infected and then 2 have severe illness because they have fewer of these. That's still a theory, but that's one of the things that we're looking at. But the evidence really does continue to show that children are less likely to transmit it, both between each other or to adults, and that they're less likely to be infected and less likely to have severe illness. So that's all good news.
Next question is from Gordon Hoekstra, Vancouver Sun.
Thank you for taking my question. Dr. Henry, I'm just wondering whether the so-called second wave or resurgence, is that inevitable? And is it specifically tied to a certain time, like the fall?
Yeah, I wish I knew. You know, we're seeing some countries around the world where they have had a resurgence, and I wouldn't necessarily call it a second wave. You know, we've managed to flatten our curve here. As we have more contacts in our community, we are likely to see more cases, whether that's a slight increase, a resurgent, or whether it becomes a dramatic increase in a second wave. That's what we're trying to avoid, and that's why we've been so fussed about having safe contacts, having small numbers, making sure that that's part of our restart program, so that we don't give the virus an opportunity to spread quickly between lots of people. And that's the key for all of the measures that we have in place right now. Whether we see a climatic related, so seasonal related second wave in the fall is another thing altogether. So I believe that a resurgence right now is not inevitable if we follow what we have been doing and make sure that our contacts that we have continue to be from a safe distance with small numbers, and that we can control it. Whether we will have a seasonal related surge when respiratory season starts again in the fall, when we know we're going to start seeing influenza, we know we're going to start seeing other respiratory viruses, that's the one that we need to plan for. I suspect it's going to happen because history tells us with every other pandemic that we've had, whether it was 57, 68, 1918, whether in the late 1800s there was probably a COVID-related one, that we have seen a seasonally related second wave in the fall. So right now, we need to prepare for that.
Next question is from Keith Baldry, Global News.
Thank you for this, Dr. Henry. Minister Dix, at the beginning of the pandemic, you were among the first to call for the border to be closed. It took a while for the federal government to do that. On Saturday, Dr. Henry, you answered one of my questions by calling on the federal government to start monitoring people as they cross the international border and contact trace there. Today, the Prime Minister said he's interested in working with provinces about the sick leave provision, but offered no timeline. Are you encouraged by that, what the Prime Minister said, or is this another case of the federal government dragging its heels? And also at Langley Lodge, given that there's been such an increase in deaths, unfortunately, is Fraser Health sending a special team in there, or what's being done in terms of external investigation of that?
Yeah, so I'll start with Langley Lodge. Yes, absolutely. Fraser Health has a team. They do it for every long-term care facility outbreak, and it's the same strategy that we're using around the province. So it involves infection control practitioners and staff, medical health officers and nurses from Fraser Health to support the team and the work, make sure that all of the personal protective equipment is used properly and that people are doing what they need to do, and the investigation, trying to track down who's in touch with whom. So yes, that is happening at Langley Lodge. It's a challenging outbreak at Langley Lodge, and we've said this before. One of the most affected units is a dementia unit, and we know that it's incredibly challenging when people have dementia to be able to ensure that they're wearing a mask, that they're staying in their rooms and things like that. And that has been part of the tragedy that's happened at Langley Lodge. In terms of I'll let Minister Dix talk about the announcement around sick leave. I think that's very good news, and I think that is something that will help all of us in terms of preventing infection in workplaces, and particularly important right now with this virus. I do also think, and we're continuing to advocate about the need, as we consider opening up our borders again, knowing what's happening in the United States, and to be frank, in particular in the United States, but also in other parts of the world. We need to be able to ensure that we are protecting our communities and our families here in BC, and that means making sure that people are able to self-isolate and are supported in doing that and are monitored in doing that. And we've seen that with our temporary foreign worker program, where we've had, we're up to over a dozen cases now of people who've come in under that program, where we have been accommodating them for 2 weeks before they go on to farms. And we need that program to continue. We need that level of support for for people who are coming into the country going forward, so that we're protected and we can make sure that people who are coming in who get sick are not spreading it to their loved ones or the people that they're here to visit, and get the supports that they need.
I think there's one question that every single person who's dealing with this in the world agrees on. People shouldn't go to work sick, and it's why British Columbia Premier Horgan has taken the lead at a national level in driving this issue, and we were very pleased that the Prime Minister's recognition of that this morning, and I think a recognition that included a discussion of Premier Horgan's role. I think that's important. I think ultimately one of the key ways on the very top of the list that we can control the spread of COVID-19 is not going to work sick, not going really anywhere sick, but staying home and getting well. That's fundamental to stopping the transmission of COVID-19, and something that we absolutely have to continue, and why I think the federal initiative joining with the provinces and taking up Premier Horgan on his arguments is useful and important. I would say with respect to the world, we should just note that the number of cases, daily cases of COVID-19 is increasing again, and it's reflecting the transmission of COVID-19 in parts of the world, in South America and Africa, which had a slow start in transmission. And the one thing we have to recognize as a world community is this is a world problem, and we have to, in every way that we can together, help one another to deal with this, because we've seen what can happen when we don't do that. So I think that we do have to act as provinces and act as countries, but we also have to act as a world in addressing this question. But it also reflects what Dr. Henry just said, which is that we have to continue to take steps when people return to British Columbia, take steps, when Canadians right now return to British Columbia, take steps to ensure that the 14-day self-isolation period is enforced and in place and is supported for people. We have to continue to do that. Any role the federal government can do and can take to improve the system that we've established here in British Columbia, we would encourage, particularly with respect to temporary foreign workers. This action by British Columbia public servants, recommended by our public health officer, has stopped the transmission that otherwise would have occurred of COVID-19 in BC. So these steps that British Columbia has led on have been important steps, and we have to continue to take them. And I'm very encouraged that the federal government is showing a willingness in one very critical area, which is supporting sick days for workers across the country, that they showed their support for that today. That's a very, very encouraging sign.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Marc Antoine, CBC Radio Canada.
Hi, I know you touched on that when you talked about drive-ins. I just wanted to, the organizers in the event industry are kind of wondering, trying to find out original ways to hold events, and they're wanting to restart their industry as well. So I know you said that in the near future it's 50 vehicles maximum, and when we think about the VIF in Vancouver, it might be also an issue for some festivals to see how they can hold their events. So I was wondering if you could again comment on that, on what kind of hope the event industry can have for the coming months, and again speak to the drive-ins. Have a comment in French, please, Minister Dix.
Yeah, I want these things as much as anybody else. And, it's the same with restaurants. We put restrictions. It's the same with our religious services. We have these restrictions. And the purpose behind them is to try and make sure that we can effectively contain this virus. And it's by effectively containing the virus that we can get our economy, we can get all of our industries going again. So I can't give you a specific time, but we will, of course, be reevaluating. And we're looking at it in periods of incubation periods. So we have 2 weeks and 2 weeks, and then we can reassess things again. You know, I realize that every industry has their own concerns and needs. And, you know, I've said this many times, we're in the same storm, but we're not in the same boat. And for some people, it's been a luxury yacht. And for others, we're really, you know, an open skiff adrift without a working engine. And we have to try and manage all of these things together. And the way that we're going to do that is by taking it slowly and cautiously. And so my intent is not to put any one sector out of business. It's to try and make sure that what we have in place is the same and equitable and is what we need to do right now to control the virus so that all of us can move forward.
Juste en français, j'ai essayé de traduire drive-in, mais apparemment c'est drive-in, je ne sais pas, il semble, mais de toute façon, je pense qu'on a mis une limite de 50 personnes, de 50 voitures, à cause de la nécessité de nous battre contre la COVID-19. Et force est de reconnaître que c'est difficile pour ces industries-là, pas seulement pour les industries, mais pour les établissements début dans la communauté, des sociétés dans la communauté, et qui inclut bien entendu des églises et d'autres établissements dans la province. Mais il faut continuer. Nous avons mis des grands changements en place il y a une semaine presque, et c'était des changements importants de la phase 2 de nos efforts, mais on n'est pas prêt de changer quelque chose de fondamental, y compris cette limite sur la taille des réunions actuellement. Ça ne va pas changer bientôt. Et il faut malheureusement travailler avec. Je sais qu'il y a des gens qui veulent trouver un moyen, mais c'est difficile avec ce règlement-là parce que c'est une ordre de la part de Dr. Henry et c'est nécessaire. Donc, on va continuer. C'est difficile pour les drive-in, c'est difficile pour les sociétés aussi, c'est difficile pour les sociétés religieuses et pour les groupes dans la communauté, mais c'est nécessaire maintenant parce que si on a une relance de COVID-19, ça va avoir une influence sur tout le monde et ça va avoir un effet économique et social profond, ainsi que, bien entendu, l'effet sur la santé des gens. Merci beaucoup. Thank you very much. Until tomorrow at 3 o'clock.
Thank you.